Hi, I'm Mark Postles, and welcome to this short little video that will give you an appreciation there of what we call the Four Choices Guide. So, when it comes to patients' understanding of chiropractic, many chiropractors assume that patients are way more advanced than they really are, that their understanding is really high level, and that therefore they can be spoken to in that context. And it's not always true. In fact, very rarely is it true. Because even if a person's really literate and has massive degrees in certain areas, they can be PhDs and rocket scientists. But when it comes to the wisdom of the body and the interrelationship of that with chiropractic with that, in most cases, there's a big gap. And so, regardless of their intelligence or their status, then there is a need for bridging that gap. And when they don't get the connection with that, they'll put it into their own understanding, their own level of understanding. They've got a pre-constructed, we all have a pre-constructed healthcare provider ladder, if you like. So, somewhere in there there's the hierarchy that they use. Maybe if it's classical or most modern times anyway, classical medicine, then physio, then osteopathic, and then maybe chiropractic, whatever. So there's a list, there's a hierarchy there that they see things as having certain priority and certain order. So the objective here is, instead of people just by default putting you into their ladder, what we're looking at doing here is giving you an opportunity to reframe it so that people can then have a new ladder created for them. So it is about challenging a few of their sacred cows. And so what we're talking about here today is four choices a patient, and I use that word probably as it is meant at this point in time, that it's a sick person, and they need to understand chiropractic care. So, on what chiropractic is. So, by the way, there is a free guide for this, and if you haven't got it already, just comment in the comments here with put four choices guide, and we'll make sure that you get one. But just make notes in this one, because you'll add to this as you go through, and as you give some thought about it, and as you talk about it with your team. So if you don't have the four choices in some sort of system within your practice, and you're not ticking these boxes, then I'd suggest that you're going to be struggling with your practice members having these three big conclusions, and they are quite endemic. And let's just jump over into the iPad where we can have a look at this and add to these. Or add the necessary missing words in here. So the first situation is that chiropractic is what? And most people would see it as some form of manual medicine, right? So that is what chiropractic is to a lot of the people that come in to see you. So then the second of these big challenges is that what is it that gives disease? And what we are born into in this particular era of humanity is a blood-borne culture. That stuff comes from, in the old days, bad blood, and that was bloodletting, but it then gave way to drugs. There's not enough drugs in the system. There's too many drugs in the system. Bad blood, diseases, insects and creatures and creepy crawlies and bacteria and viruses. Our technology gets a bit better. That is there giving disease. So bad blood is considered to be the instrument of disease. So that's an attitude and an idea which is very, very prevalent. Now, the third area is that chiropractors work with the joints. And well, that's true, but there's an exclusion here, and that is not with the whole person. So how could the joints affect the whole person? And so that leaves a huge gap there. And so when it comes then to what it is that chiropractors treat people for and treat being an operative word in this context, they treat them for pain. Right, so here we have chiropractors are manual medicine, so somewhere in the medical ladder. And it's not above medicine in most cases, that's for sure, and it's probably hardly above many other therapies or medical applications of an allopathic nature. That bad blood gives disease, so really you get sick because of bad blood, and we get well because our blood gets purified by something, usually an external agent. So, and then there's chiropractors work with the joints and not with the whole person. So that's where the whole person is separated from the joint system. And fourthly, that chiropractors treat people for pain. So that's the reality for most people. So we need to change that, or at least that needs to be challenged. They change it, but we need to challenge it. Or put it this way, we have the opportunity to challenge it as we work with people. Now, this is not necessarily an overnight thing. However, the pattern interrupts need to happen pretty quickly when the person first comes in, because they will continue to hold that position if it's not challenged. And so there's a relationship here with time, and time needs to, in terms of your contact with the person, the time needs to be fairly soon in the piece. I mean, on the first visit for a lot of this, and within the first few minutes of the first visit for much of it too. In fact, the onboarding forms and so forth are critical in this context. So let's just have a look at this one here. What would be the option here? So maybe if we took it from chiropractic's manual medicine, so the reframe then is that chiropractic is at the top of its own ladder. So in other words, we need to, it's got to be a different ladder, and normally health is considered to be absence of disease. So we have to look at how we can reposition us to be the top of a health ladder, or top of not even health possibly. You may say, okay, well, it's the top of the human potential ladder. Right, so that's not even to do with health. Well, to some degree it's to do with health, but it's not necessarily a healthcare profession as such. It's more about human potential, about optimization. So the framework has to be around that. And the investigation initially has got to be totally upside down relative to the normal medical model, so that then instead of asking what's your problem, what are your symptoms, we ask, what's your history? What are the things that have gone on for over the years up until now? And oh, by the way, at the very end of this, at the bottom of this, it's like, oh, you might have a given problem for right now, maybe not. If it is, just jot it down. Just let us know. So in other words, it's switching it all around in terms of the priorities. So if chiropractic can be positioned at the top of a different ladder, then the priority is the health and what is optimal, rather than what's the problem, and then getting down to maybe if we get that cleared, then we can do prevention, and then we could do maintenance, and maybe then we could do something around optimizing your potential. So there's a very distinct ladder associated with this. The next level in bad blood is, well, what happens when we reposition brain, spine, nerve system as a priority? So the brain then has a major player. The spine is an incredibly intricate part of this whole thing. The nerve system then becomes the focus, and that affects the body. So within this context then, people can start to see that disease is a lack of ease. It's a lack of the normal function of the brain, spine, nerve system, and so structure then affects function, and that becomes the operative way of thinking for a person as they reposition away from the bad blood ideas. And then the third one being, instead of chiropractors don't work with the body, they just work with your joints, then we have to reposition that one. So we look at the spinal visceral relationship at every opportunity. So it's they say it's not with the whole person. We always connect the spine with the viscera. Right, so this area here, whether you're going with a merit chart or reflex charts or whatever it happens to be, the relationship between the spine and the viscera, the spine and the function of the body, then the structure of the spine and the function of the body. Then they start to get that structure equals poor function, and ultimately in that pathological sequence of decay, we have death down the bottom here. But the study of pathology obviously is a study of death, and that then is repositioned to see that it's the structure of the spine. There's a relationship to health, and so people can take that on board, and so then that starts to gather the momentum, so that the fourth area here, chiropractors treat people for pain. So when they start to see that there's a relationship between structure and function, then they'll start to extrapolate that chiropractic is a utilization, or its utilization is for the health and optimization for all people. So really the take home from this is if a person out of these four choices can come to all people can benefit, and that's especially for young people. And there's lots of evidence procedure that's maybe necessary for this and the realities of your practice. But if you can get them through these four segments, just very gently, and by virtue of not so much what you say, it's actually what you do, the approach you take to various issues that come up for them, the paperwork, the forms, the structure of your technique application, and so forth. Those are all considerations that come into guiding people through into four choices that are far more efficient and effective for that person. So once again, instead of chiropractic being manual medicine, and we reframe it as being top of its own ladder. And instead of being bad blood gives disease, you position the brain spine nerve system as a primary. And instead of chiropractors, don't work with the body, just joints. You link the spine on the visceral association every opportunity that you have. So the fourth one being, instead of chiropractors treating people for pain, you extrapolate and utilize chiropractic as an instrument and a facilitator of health and optimization for all people. So that will start to ask people to get people asking better questions, and within that, then they'll make better choices. So if you don't already have the four choices guide, just grab it here. Let us know, and we'll certainly send it to you. And if you'd like to have more help with this in your practice, because it is a bugbear for a lot of chiros and stuff, okay, this is fine, but how do I do this? Then just make a time. We can catch up, have a chat, and see if there's any way in which we might be able to help you with our resources or with our coaching to allow your people to scale up quicker, so that they can go through that initial phase of care and they see the rationale for going beyond that as they experience the wins that come from high levels of care. So I'm Mark Postles. Have fun. We'll catch up with you soon. Cheers.